Hi, I'm Deb Tobiason in biology at Carthage College, and today I get to speak with two professionals who are helping right now with the COVID-19 outbreak. One is Dr. Gail Gizzo-Waitley, who is a medical um, specialist in the ER room, and her husband, David Waitley, who is an infectious disease specialist, also working at the hospital. And their son is actually David Waitley, who is a senior here at Carthage College. So I wanted to start by asking you both, this COVID-19 pandemic is truly an unprecedented event in our lifetime. And I was wondering how this is affecting you, especially as medical professionals.
Well, just like everyone else, we have to practice social distancing as well, maybe even more so due to our continued exposure to the coronavirus. We're unable to visit family. We've canceled sporting events, vacations, spring break. We're unable to go to the gym, things like that. And without a pandemic, our jobs are pretty stressful, and these things help us to alleviate some of that stress. Things have changed also at work. We now have to put in more shifts. We work more days. We have to be available in case one of our partners gets sick or have to go under quarantine. Now throughout the day, we're constantly wearing masks throughout the hospital, and that gets a little tiring and uncomfortable. We're constantly disinfecting our pagers, our phones, our stethoscopes. We have to check in prior to entering the hospital now. We have to walk in through an infrared machine to check our temperature. We are answering questions to make sure we don't have signs and symptoms of the COVID-19. Once we get home, we're taking our clothes off in the laundry room and running right into the shower immediately. But on the brighter side, the community has really been very supportive. They're bringing the emergency room staff food, candy. They're making us masks and hair covering. So there is a little bit of a brighter side to this.
So another question I had was that the virus appears to cause a variety of symptoms. For example, some say they lose their sense of smell. And I was wondering, what are the most common symptoms that you've found or seen?
Well, there can be a wide range of symptoms. People can even be asymptomatic with this virus. But the most common symptoms that is associated with COVID-19 are what we call influenza-like illness symptoms. And that's fever, usually greater than 100.4, marked fatigue, cough, mostly a dry cough, no sputum production, loss of appetite, muscle aches, shortness of breath, and a sore throat. Less commonly, we do see the loss of smell, loss of taste, headache, runny nose. And lately, in the emergency room, I'm seeing people presenting with GI symptoms, nausea, vomiting, diarrhea, and abdominal pain. Yeah. But most of these infections are not severe. We see the severe cases in the hospital. And symptoms range from mild to very severe, especially shortness of breath. Even patients who present with mild symptoms can progress to more severe symptoms over the course of 7 to 8 days. I don't know, have you seen anything else, Dr. Waitley, regarding any symptoms that I'm missing from your end?
No, that's pretty much it. I think you're catching it early. You're catching the patients earlier when you see them, and then I may see them a little later on. We see there's about probably 80% of the patients that are going to be sick very mildly, whether they may not even require hospitalization or just have sort of a bad cold-like thing. 5% of people will be on a ventilator, and 2% of people right now die of this disease. So we're seeing people on ventilators, and we're seeing some pretty sick people here at the hospital.
And most of the cases, the fatal cases, are in people who are in advanced age, over the age of 65, or have underlying, medical problems like heart disease, autoimmune disorders, hypertension, diabetes, kidney disease, cancer, and even obesity.
Wow. So it's quite a variety of symptoms. So it's kind of hard to tell maybe sometimes if what they're coming in with is this virus, right, or something else. I can imagine that's difficult. Another thing that has popped up quite a bit lately, the last couple of weeks, is the idea of trying to find therapies, obviously, for this. We know the vaccine is a ways off, but what are some therapies? I know one publication, or several publications actually, have shown that ACE2 is the receptor for this virus, right, SARS-CoV-2. And they are actually looking at making purified ACE2 to bind to the virus and essentially block it from binding to the host cell. And I was wondering what other possible therapies you're seeing as promising for treating COVID-19 in the hospital that you're at.
I'm gonna leave
that one. I can address that one. Thank you, Deborah. So yeah, we had that kind of thing with the HIV, with the soluble CD4. That didn't work out, so I don't know what's going to happen. Obviously, everything's fair game right now because there's so many cases.
Right.
But we're using things like Plaquenil and azithromycin. Those are antibiotics. Neither of them are antivirals. They're having some benefit, but there's some mixed data, I'll say. That's at this point. We're not really sure about it, but that's what we're using right now. Steroids may also help if necessary. By the way, we're not treating every patient, but we will treat people with fevers or if they need oxygen, and we will usually treat them with those two antibiotics. If they're worse, then the things next in line might be steroids. There is a medication that's under clinical trial right now, remdesivir, that was also used for Ebola. And we at Good Samaritan Hospital cannot get that. You have to be part of a clinical trial. So right now I'm not able to use that medication, but we need these trials. They're very important. So we'll be looking for data on remdesivir. That looks very promising. And then there is, of course, this interleukin 6 inhibitor, which is called tocilizumab. And that also looks promising. We're using that in rather sick patients. Some of these patients do go on to, beyond their cold, to get what's called a cytokine storm, where these body hormones, these cytokines, they're made by the cells. They help your immune system. They help to fight the infection, but sometimes they're over fighting and they could cause damage themselves too. And this tocilizumab is being used as a 1 or 2 dose intravenous infusion for people, say, nearly on ventilators. So it's for severe cases. Another option we're looking at is the plasma, the COVID positive patients donating antibodies. There are no studies on that. We are working we're keeping a log of our patients with COVID-19, and after 28 days, when they've gotten over the infection, we're going to be asking for some donations of plasma and trying to get this thing started. But right now, this is very much in its infancy with this antibody donation. The other two things, there's a study coming out with prazosin. Prazosin is an antihypertensive. It's an alpha blocker. It is thought that prazosin may help to block this cytokine storm. So that has to be looked at. Unfortunately, a lot of these patients with cytokine storm have low blood pressure, and prazosin is antihypertensive. So that will cause exacerbation of low blood pressure possibly. So, and again, that's early on. The last thing is that this COVID seems to cause microthrombi or clots in the lungs. And so if you could somehow prevent or treat those clots, that may really help the person's oxygen and help them get off the ventilator if they are in that kind of condition. So we're checking what's called a D-dimer, and if that's elevated, we're giving full anticoagulation to these people, and we think that that's helpful also.
Wow, that's great that there's multiple on the table now and going through trials, so hopefully you can have more to use. Ultimately, obviously, development of a vaccine is what's really gonna help protect people from the virus, right? And stop the cases from coming into the hospital. What do you think can be done while we wait the 12 to 18 months for a vaccine to be available? Do you have any suggestions for people?
Yes, well, for everybody, especially the older individuals or individuals with chronic illnesses, social distancing is still very important. Stay at home as much as possible. Maintain 6 feet distance from others when you're out. Avoid crowds and certainly avoid contacts with sick people. Diligent hand washing with soap and water is the best. If that's inconvenient, use a sanitizer with at least 60% alcohol, especially after touching public surfaces, even at the gas station when you touch the pump. Sanitize. Cover your cough and sneezes. Avoid touching your face, especially your eyes, nose, and mouth. Avoid wearing contact lenses. Clean, disinfect objects that are frequently used. Even your car, your steering wheel. Wear a cloth face covering when you're out. Now, that may not help prevent you from getting the disease, but it may prevent transmission from individuals who have asymptomatic or pre-symptomatic infections.
That's all really good advice. So in terms of for the next month, so definitely it sounds like social distancing, right? And continuing what people are doing is the way to go. When do you think that will stop? Basically, is there going to be a point when we can stop the social distancing? Any thoughts on when that could be? I mean, right now I feel like Wisconsin and Illinois haven't quite reached peak yet, possibly, right? So. Any ideas?
Dr. Waitley?
I'm sorry, I was going to chime in on the other part of what Gail was saying, which was that your most dangerous times are probably mealtime and going to the grocery store. Yeah. So mealtime, of course, you're taking your mask off, so it's really, really important to stay 6 feet away. And then the grocery store, because that's where everyone is going these days. That's their way to get out of the house. So.
Right.
And then what was the other question? I'm sorry that you said.
It was just that kind of leading off of that, what advice do you have for folks just for the immediate future, kind of like the next month or so? I guess the social distancing would be the advice to maintain that, it sounds like, right?
What Gail said is exactly right. And just be patient. It is going to get better. The curve is starting to flatten, and this is working, and we really need to keep doing this. We really do not need to get out there. I don't know why there's all those people on the Tri-State Tollway yesterday, and there's a big accident on the Kennedy, and these people just please stay home. It's very, very important.
Right. Yeah. And also, hopefully people who are working in grocery stores and places like that will start wearing masks as well, and helping to stop the spread as well, right?
It also helps if you yourself keep up your immune system. Make sure you get 7 to 8 hours of sleep, exercise 30 minutes a day, limit alcohol, and definitely stop smoking, stop vaping.
Yeah. That's all really great advice. Well, thank you. Those were all the questions that I had for today. I really appreciate getting to hear from the front lines what your thoughts are with this. I know this is going to be ongoing and changing, and it's really good to hear what your advice is.